Today, Americans for Prosperity kicks off our Patients First campaign here in North Carolina. We're going to be going all across the state to tell Congress, hands off my health care. We do need health care reform, but we don't need a big government takeover of health care. We need to support free market solutions to health care, and that's what we're here doing today. What does this say? I didn't hear you. Ladies and gentlemen, I do not want a Barack Obama bureaucrat deciding what my life is worth.
What I talked to you about today, that benevolent bureaucracy that can take care of all of your needs, is the same exact bureaucracy that wants to take control of our medical insurance. The same bureaucracy that wants to steal our lives from cradle to grave. Authoritarianism, disguised as a benevolent bureaucracy, can lure any freedom-loving society into totalitarianism at the expense of each and every individual, at the expense of being relegated to the breadline of the entitlement state just to line up and be quiet and take your voucher and your entitlement program. That is not what the founders of this nation envisioned. That's not what made America a great and innovative nation, a leading nation. That's not what's lifted so many millions of people out of poverty into prosperity. And that's not the future of America. I hope you will derive from my story and my personal experience the need to put America back on the path towards individual responsibility and opportunity, and to fight against the ease of which we can easily slip into an entitlement state where each and every one of us is relegated to an amorphous mass of humanity where no one has an identity. North Carolina, New Jersey, from Maine to Florida to Texas, we're all on this together.
This is something that we need to be worried about. It is our future, it's our children's future, and frankly, it's our grandparents' future too. And we do need to work to find solutions. And we need to speak up and have a voice on this issue. And we've got to make sure that the process is transparent. We've got to make sure the process is affordable. We've got to make sure the process is sustainable, long-term, that won't bankrupt this nation or our federal government within a few years. And we've got to make sure we understand this is a crisis. But in dealing with a crisis, leaders do what's right. They don't just do something. And that's the way we must think in leadership.
Start with a question: how did we get here? A few moments ago, we watched a video of a woman in Oregon, Barbara Wagner. A government of the people, by the people, and for the people denied her chemotherapy and instead offered physician-assisted suicide. How did America reach a place in her history where that is what we're becoming?
What we need to do is people to call their members of Congress, to call their senators, call Senator Hagan, and let them know that big government health care is not what we want. We want options. We want ability to buy health policies across state lines. We want the ability to pick our own policies and our own doctors.
And sign petitions. Get on these websites, sign every petition you can, because this is ammunition for organizations like ours. We need thousands and thousands and thousands of people to be involved so that we can take it to congressmen, take it to legislators, and say, we are a real grassroots organization.
Ladies and gentlemen, it's your health care, and it's our rights, and it's up to everybody in this room to defend it to the very last day, to the very last hour, with the very last breath.